Good morning, everyone. Today, we are tasked to report the 21 nursing problem theory of nursing by the theorist Faye Abdellah. And before we start, allow us to introduce ourselves first. My name is Jerwin Egara.
My name is Eliza Gunyo.
My name is Abdellah.
Before we start, we are saying sorry for some background noises that we will encounter. The 21 Nursing Problem Theory of Nursing by Faye Abdellah. About the theories. Faye Abdellah was an American pioneer in nursing research who developed the 21 nursing problems. First woman to serve the Deputy Surgeon General of the United States. She's also a nurse theorist, military nurse, and a leader in nursing research. Developed changed the profession focus from the disease-centered approach to patient-centered approach. And also, she believed that an evidence-based practice on scientific data has a great impact in nursing research.
In March 13, 1919, Faye Abdellah was born in New York City. In 1955, she obtained her Doctor of Education from the Teachers College, Columbia University. In 1973, she wanted to be a nurse after she saw the Hindenburg explosion. In 1960, she was influenced by the desire to promote client-centered, all-inclusive nursing care. In 1942, she finished her basic nursing education in Fitkin Memorial Hospital School in Nursing. In the year 2000, she inducted into the U.S. National Women's Hall of Fame.
Major concept of 21 nursing problems theory. Abdellah's theory proposes that nursing is the utilization of the problem-solving techniques with the chief nursing problems related to the health requirements like major concept of 21 nursing problems theory. Nursing problems health needs are seen as problems which may overt which is obvious on or can be seen condition, convert which is unseen or minus one. Abdellah's usage of the terms nursing problem is more in tune with nursing goals and nursing function that client-centered problems. She refocused the role of the nurse from the disease orientation, but maintaining her clients as the main concern, the needs of patient, basic to all patients. Centennial care needs, remedial care needs, restorative care needs. So as a nurse, we need to provide the needs of our patient. The first one is basic to all patients. Let us provide what is right care they need. Second, sustainable care needs. We need to maintain the cares that they need for them. Remedial care needs we need to provide action to our patient so that in case of any problem we are there to support them. Last is restorative care needs. We have to fix and check if they're okay or comfortable and always check our patient.
Major concept of 21 nursing problem theory. B. Problem solving. According to Abdellah, the practice of competent nursing care in the future for the nursing student to realize that identifying and answering overt and covert nursing problems is the core of nursing. This requirement can be met by the problem-solving process. Problem-solving process number 1, identifying the problems. Problem-solving process number 2, selecting the relevant data. Problem-solving process number 3, devising hypothesis. Problem-solving process number 4, testing hypothesis through assorted data. And problem-solving process number 5 is revising hypothesis when necessary. The 21 nursing problems and its 3 major categories. Number 1, physical, social, logical, and emotional needs of patient. Number 2, types of interpersonal relationship between the nurse and the patient. And number 3, common elements of patient care.
The classification of 21 nursing problems. Basic to all patients. 1. To maintain good hygiene and physical comfort. 2. To promote optimal activity, exercise, rest, and sleep. 3. To promote safety through prevention of accident, injury, or other trauma and prevention of the spread of injection. 4. To maintain good body mechanics and prevent and correct deformity. 5. To facilitate maintenance of supply of oxygen to all body cells. 6. To facilitate maintenance of nutrition for all body cells. 7. To facilitate the maintenance of elimination. 8. To facilitate the maintenance of fluid and electrolyte balance. 9. To balance the physiological responses of the body to disease and junction. 10. To facilitate the maintenance of regulatory mechanism and functions. And 11. To facilitate the maintenance of sensory functions.
Classification of 21 nursing problems. Remedial care needs. To identify and accept positive and negative expression, feeling and reaction. 13. To identify and accept interrelatedness of emotion or organic impulse. 14. To facilitate the maintenance of effective verbal or nonverbal communication. 15. To promote the development of productive interpersonal relationships. 16. To facilitate progress toward achievement of personal spiritual goals.
Number 17, to create or maintain a therapeutic environment. And number 18, to facilitate awareness of the safe as an
Next
individual with varying physical and emotional development needs.
The restoration care needs of the classification of 21 nursing problems. Restoration care needs number 19, to accept the optimum possible goal in the light of limitation, physical and emotional. 20. To use community resources and aid in resolving problems that arise from illness. And number 21. To understand the role of social problems as influencing factors in the cause of the illness. In Abdellah's 21 problem, they are according to a model describing the arenas of concerns of nursing, rather than a theory describing relationship among the phenomena. In this way, the theory distinguished the practice of 21 nursing problems from the practice of the medicine with the focus of disease and care. The problem solving. The problem-solving process involves identifying the problems, selecting permanent data, formulating hypotheses, testing hypotheses through the collection of data, and revising hypotheses where necessary on the basis of conclusion obtained from the data. Next slide. Faye Abdellah meta-paradigm of the theory. Abdellah considered nursing as an art and science that molds the attitude, intellectual competencies, and their needs when they are sick or well. The first concept in the meta-paradigm of the theory is nursing. Nursing, an all-exclusive service that is based on the discipline of an art science that serves individual sick or well cope with their health needs. In Abdellah's model, nursing care is doing something to do for the person or providing information to the person with the goals of meeting needs, increasing or restoring environment. The second concept is the person. Abdellah classifies the beneficiary of care as individual. The 21 nursing problems relate with the biological, physiological, and social aspect of individuals that corresponds to concept of importance. Abdellah described the people of having physical, emotional, and sociological needs that these needs may be overt, consisting their largely physical need, or covert, such as emotional and social needs. The third concept is the environment. Planning for optimum health and local, state, national, and international levels, the apex of nursing service is the individual. The environment is the home of community from which patient comes. And last is the health concept. Concept of health, the center of purpose of nursing services, she speaks to a total health and a healthy state of mind, mutually exclusive illness. Although Abdellah does not give the definition of health, she speaks to a total needs and a health state of mind and body in her description of nursing as a comprehensive service. And that is the concept of metaparadigm in Faye Abdellah's theory. Next slide.
Use of 21 problems in the nursing. As a practice underlying the problem-solving approach is that for each identified problems, written data are collected. In this phase, we need to access and collect data for the problem identification. Using diagnosis, the result of data collection will determine the client's specific over and covered problems. After we connect and have result, we need to determine if our clients have over and covered problem. So we are going to diagnose them according to the result. Planning. The planning space, the statement of nursing problem must closely resemble goal statement. Therefore, once the problem has been diagnosed, the goal have been established. So in this space, we already has a goal to establish in order for us to solve the problems. Next. Implementation. Using the goals as the framework, a plan is developed and appropriate nursing intervention and determined. So we have a clear goal. The next thing to do is to create a plan that are appropriate and well determined. Evaluation. This is difficult, if not impossible, to do for Abdellah's nursing problem approach, since it has been determined the goals are nursing goals, not the client goal. So it is not impossible for us to do the approach that Abdellah's nursing problems have, because the goal of it's focused on the nursing goal, not for the client goals.
Abdellah's typology of 21 nursing problems is a conceptual model mainly concerned with patients' needs and the role of the nurses in problems identification using problem analysis approach. Next slide.
So, focus of care pendulum, nursing-centered, patient-centered, and disease-centered. It was mentioned in the first slide that it is the client-centered or patient-centered approach which Abdellah professes to uphold. So basically, the focus of care pendulum explains her desire to move away from a disease-centered orientation. In the diagram, she seems to swing the pendulum to the through opposite pole from the disease orientation to nursing orientation, while leaving the client somewhere in the middle. Acceptance by the nursing community. Practices. Abdellah's typography helps nurses and nursing students perform in a scientific and systematic way. Using this scientific foundation will empower the nurse to give meaning to each and every nursing action that he or she will perform. The clinical practitioner could access the patient, make a nursing diagnosis, and plan intervention. Using the typology in the clinical setting, nurses will now give their work an empirical basis.
Acceptance by the nursing community. In education, revision are the prime importance if nurses were to become self-governing.
The biggest flaw in the profession was the absence of limited base of scientific body of knowledge. The typology gave the most crucial and timely opportunity to move away from the medical replica of cultivating nurses.
Acceptance by the nursing community research. In 1965, Abdellah and Levin released the first major textbook in nursing research, entitled Better Patient Care Through Nursing Research. The typology became the root for cultivating the nursing care model and was the staffing outline in clinical setting. The staffing patterns were found on the client's identified needs. They comprise of intensive care, immediate care, long-term care, self-care, home care units.
For the analysis and evaluation, the first is simplicity. The typology is straightforward and it's practical to use among clients. In generality, the typology are collective and associated to neither time nor environment. The goals of this typology are suited for nursing. Empirical position. The concepts are exact with the empirical referent that they are easily recognized and are exclusive of the field of nursing. Their valuable consequences. The importance of problem solving is not restricted by time or space and gets away from continual growth and change in the service of nursing care.
Chapter Summary: Abdellah's 21 Nursing Problems Nursing Theory. The 21 Nursing Problems Theory was developed by Faye Abdellah. Her model of nursing was progressive for the time in that it refers to a nursing diagnosis during a time in which nurses were taught that diagnoses are not part of their role in healthcare. There are specific characteristics identifiable in the 21 of nursing problem. The theory has iterated the concept of health, nursing problems, and problem solving. Problem solving is an activity that inherently logical in nature. The framework focuses on nursing practice and individual patients.
We'll end this presentation by showing our favorite quote of Faye Abdellah. We cannot wait for the world to change. Those of us with intelligence, purpose, and vision must take the lead and change the world. Thank you for listening.
Thank you for listening and have a great day ahead. Goodbye!